I have basically been studying the effects of the environment on air quality and health for the past 5 years, which started when I was involved in opposing a biomass plant in Jasper, Indiana. At that point, I noticed that there were discrepancies between the claims that I heard from city officials and what I noticed on environmental pollutants, where they were mentioning things like heavily monitored, but it really wasn't heavily monitored. Not only that, for basically now 27 years, I've seen a lot of health issues that appear to point to an environmental cluster, whether those are birth defects, cancer clusters, etc., and a remarkable and very concerning lack of follow-up by our state government, where health officials are aware that there are problems, but the statistics that are used to say that there isn't a problem don't appear to be valid. And so that was one of the reasons I did the research that I have done, and this is a research poster that was at the International Congress of Pediatrics in Vancouver in August of this year, that basically shows that despite the fact that we have an extremely high infant mortality and a concentration of coal-fired plants, there really are no air quality monitors, which is, and yet the state officials make statements as if things are improving. And so the bottom line statement is that serious scientific flaws exist in Indiana air quality management, where there are not enough monitors, they're not in the right place, and the statements that are being made by officials are not valid, as well as the fact that industry controls a lot of the monitoring. And so what that means from an infant mortality standpoint is we don't know where we're at. But the whole reason that these pollutants are regulated is because they're toxic, potentially to pregnant women, to children, to vulnerable populations. So there's just a huge discrepancy between what we know is out there, and we know what these industries are emitting, and the effect that is acknowledged on health. And it's actually fundamentally obstructed. And that's what I think needs to change, so that we can have a better and more public dialogue. And another issue is that much of the industry in southern Indiana is for electricity and for northern Indiana. So there's a big discrepancy as well in the amount of emissions that we are getting for our own power production. Most of the electricity that is here is actually so that the air is much cleaner up there. And I think that I would wonder if people in northern Indiana were aware the degree to which southern Indiana is polluted and the effect that it is potentially having, and why is the state, if infant mortality is such a priority, why aren't we talking about this? Why aren't we looking at this? And why are we using fundamentally flawed science and statements when it is our babies and our children that are being affected?